2001, 29 British women froze their eggs. But in 2014, that number had soared to 816 women. So why are so many more of us choosing to freeze our eggs, and what exactly happens during that process? I'm here with Dr. Geeta Nargund. She's the Medical Director of Create Fertility Clinic and one of Britain's leading fertility experts. So, Professor Nargund, why are so many more women freezing their eggs?
I know the media kind of sometimes says, well, it's because they are just pursuing their career. That's not always the case. In fact, the studies have shown that the most common reason is absence of a partner, okay?
Is there an optimum age that you think women should freeze their eggs?
I would say in their early 30s, if they want to consider freezing eggs, not to leave it until after 35 where possible, because age of the egg matters. That's what really determines the success of egg freezing. Egg freezing is not a guarantee. It's an option, and it is an option for women who have to delay so that they can use their own eggs afterwards rather than rely on donor eggs.
Have there been many babies born from egg freezing?
There are thousands of babies born, in Italy, Spain, and other countries. Remember, the first baby from egg freezing was born in 1986. Okay, so that was, 30 years ago, wasn't it? So it was not yesterday. Let me tell you, why we're talking about egg freezing now so much is not just because more women are coming forward, because technology has made it more successful. We now have a method called vitrification, which is the fast freezing method for eggs and embryos. With vitrification or fast freezing, more than 80% of eggs can survive the thawing process.
So Dr. Nargund, I guess I should ask, are there any risks involved with egg freezing?
Quite clearly, if a woman is given very high dose drugs, then she's at risk of developing a condition called ovarian hyperstimulation syndrome, which is not a nice situation, and in its severe form, a woman can end up in hospital. So it is very important that a woman asks questions about using lower dose drugs and preventing this condition. So that's about drugs. But the egg collection procedure is a very small risk of bleeding, in fact vaginal bleeding, which stops normally after a few seconds or few minutes of pressure, but there is also a very small risk of internal injury and bleeding. So she really needs to understand that medical procedures do carry risks. There are ways of minimizing these risks.
That's a really important point, is the risk. So once we've weighed everything up, tell me a little bit about the costs involved, not only of having your eggs frozen, but of, I guess, storing them, and then when you decide to thaw them.
The basic cost is under 3,000, but there will be added costs. So one has to realize that. And then, of course, there's costs for storage of these eggs. So there will be an annual fee for storing these eggs in the laboratory. And that's usually a couple of £100, or I don't know, maybe slightly more. So, but there is an annual fee for storage, which needs to be taken into account. And then when you thaw them, there is additional cost. But remember, when you thaw them, you don't have to undergo that whole procedure of drugs and having an egg collection and all of that. So because that's already been done. So what it would mean is, depending on whether it's your partner's sperm or donor sperm, if you're using donor sperm, again, you have to pay for donor sperm. And then you're looking at injecting these eggs, what we call ICSI, which stands for intracytoplasmic sperm injection. So that does cost money. I don't know, it's in the region of £1,000 or so. And then fertilization and putting the embryo back, and actually undergoing a frozen embryo transfer procedure. So that, I don't know how much it costs in other clinics, but the actual frozen embryo transfer procedure costs £950 in our clinic. So we are looking at, once again, a couple of £1,000, I suppose, yeah? So no, we are talking about money in thousands here, but we have to aim to try and reduce this cost, okay? Because young women don't have this kind of money. So, I have supported the employers funding this for women who need to freeze eggs. Yeah.
Okay, thank you, Dr. Nargund. So I guess the message there is consider, if you're freezing your eggs, think about the cost because it's not cheap. So thank you very much. Dr. Nargund is speaking at this weekend's Fertility show, which starts on Friday at Olympia. So if you've got more questions, head down there. Thank you.
Thank you.